Hi there, my name is Nisha Kosarian, and this is what inspired me to become a nurse. When I was younger, I was in and out of hospitals a lot because I had numerous different respiratory issues. But growing up around healthcare workers, I started to observe that nurses are the ones that closely interact with these patients the most. Um, a lot of my nurses were very kind and reassuring of my situation because being a kid in a hospital is not the funnest thing in the world, but they went out of their way, went above and beyond to make me feel comfortable and understood to where I never felt out of place in the hospital. Um, it inspired me by how supportive they were mentally and physically, especially targeting my emotional needs while the doctors were targeting my physical needs. Um, it made me develop the desire to provide the same type of care for others. I've always had a very, I wouldn't say nurturing, but a very strong feeling of wanting to help others. And I wanted to pursue it this way. Um, I have learned that patient care is not just the medical tasks. Emotional care is just as important as the treatment. Communication and empathy are one of the biggest things that makes a difference in people's lives and the biggest difference in their healing. I believe that patients deserve to feel heard um, and respected and valued. And in any situation, I would advocate for any of these patients that don't want to use their voice or be the voice for the unheard. Um, for my ethical dilemma, I had a situation with one of my coworkers very recently who I knew outside of work and had a very tight relationship with. But one of these caregivers was not treating a resident with consistent dignity and respect. Um, and I did wait a little bit before I did report it, but I chose to report the situation despite all the personal relationships that I had with this person. And it was a little uncomfortable at first because of the personal relationship I had, but I prioritized the patient's safety and their dignity over my personal relationship. And looking back to it, I don't regret a single thing I did, but it was a big step to take because I felt like I was friends with that person, so it was hard, but it was what needed to be done, and it wasn't something that I needed to think about for a long time. It was just kind of set that this person isn't being treated well, and that's that, and I have to act upon it. What I learned from this situation, though, is patient advocacy is crucial because these people don't are in situations where they don't want to advocate for themselves and they will go out of their way to not do that. So you have to kind of put the pieces together and find out for yourself what's going on and act upon it. Um, Patient dignity must always come first, and being silent just allows the harmful behaviors to just keep continuing. And but I feel like one of the biggest things from the situation I learned was just reporting it sooner when I see it rather than trying to add up all the points of what they are lacking in and then report it. Um, but I also learned that I need to separate personal relationships from professional relationships, even if that causes for my relationship with that person to end. Um, but overall, I would again and again choose patient advocacy over anything, and I will continue to do so.